like we're like I said, those soldiers on the boats getting ready to storm the beaches of Normandy. We're just there. We feel the waves, but we're not on the beaches yet.
As California shelters in place, our medical workers are preparing for a battle like none before.
And I watched the doctors and the nurses walking into that hospital this morning. It's like military people going into battle, going into war.
Before we were just, it's just coming to work, but now we're seeing the pandemic and this battle coming, and we're now banding up together and becoming a band of brothers and sisters who are now ready for battle.
A sense of soldier-like camaraderie is part of how they're not just preparing, but coping.
There's just kind of a sense of spirit, within the staff that's, I'd say better than it would have been without this, trying times, kind of melting us together as a stronger unit.
I listen to music and just rock myself up. Same way how when I played sports as younger.
Taking every opportunity I can to be with family and just kind of enjoy the outdoors.
As they plan and brace, those of us at home are hailing them as heroes. But these heroes are also human.
I think, it's becoming real for us after seeing what's happening in New York, that we're very likely, a lot of us, going to be confronted with coworkers dying.
So there is that anxiety that you do that as a clinician to be ready for this epidemic, and that's spread to my family.
Getting sick themselves as well as bringing the virus home is a major concern for those on the front lines.
I'm definitely worried about, getting sick myself. I certainly don't want to die early.
Having protective gear is essential, something that all the healthcare workers we spoke with said has been an issue, forcing them to take matters into their own hands.
Very quickly we realized this is going to be something that's going to overwhelm us. And I can tell you that in the ER where I work, a couple weeks ago, doctors, nurses, and respiratory therapists figured out really quickly that the hospital wasn't going to be able to figure out how to provide us with all the protective equipment we needed. And so we started a fundraiser, and now it's up to almost $50,000. And the hospital basically was just not obtaining some of the gear that we need. And so we spent a bunch of time together researching those supplies, and we researched them and then found some kind of in the dark corners of the internet from legitimate suppliers and bought them. And actually the first ones just arrived today.
Dr. Torgerson's sister even went as far as raising funds and rallying supplies from within the community.
We definitely had a significant deficit. Fortunately, the community here is really rallying around the hospital, and it's made a huge difference. And we still have some needs that we're working on, and my sister's working on very aggressively, which is nice.
And while they hope they can get the proper supplies, the risk they're taking in providing care is why they went into medicine.
When you get to work and you're kind of in work mode and you know that you're just here to save people, you don't really worry about yourself as much.
And I trained my whole life to be in this position to help people.